Hello everyone, thank you for tuning in to this very exciting episode of The Science Show. I am your host Jordan, and this episode will be discussing the topic of HIV or AIDS. First off, what are HIV and AIDS, you may ask yourself? Well, for the answer to that question, we may need to ask our friend the narwhal.
Well, HIV and AIDS are horrible diseases that are a problem worldwide. As of right now, there is no known cure for HIV or AIDS.
Interesting. Can it be stopped?
Yes, the only reason it's a worldwide problem is because people aren't informed about it.
And that is the reason for today's episode, to inform our viewers. So how about we start with the evolution of the virus? Stage 1 of the virus is primary infection. This typically lasts about 1 to 2 weeks when the virus first establishes itself in the host's body. Once a person is infected, their body releases antibodies, which are a protein that fights the virus. These antibodies can be detected by an HIV test, usually in about 6 to 12 weeks. Stage 2 is the asymptomatic stage. Asymptomatic means not showing any outward signs of infection, so an infected person could have HIV and not even know it. These people look and feel completely fine for many years until, eventually, Stage 3 hits. Early and medium stage HIV is when the immune system is compromised, like... Director. We've been compromised. Okay, kind of like that, but once it's compromised, many people begin to experience mild HIV symptoms, like skin rashes, fatigue, night sweats, weight loss, and fungal skin and nail infections. The last stage is late-stage HIV disease, or AIDS. Receiving an AIDS diagnosis does not mean that the person will die soon, because some of the people have lived many years after the diagnosis. Alright, there's the evolution portion. Now, stay tuned. We will return after this commercial break.
Are you tired of eating cereal with a fork? Well, introducing the new spoon.
And we're back. We just discussed the stages of HIV and AIDS. Now it is time to talk about the language of HIV and AIDS. And to do that, we will be going over several words related to this. Our first word is antibody. Antibodies are proteins released upon primary infection. Next is AZT, which is a medicine which helps to strengthen the immune system and may improve the infected person's health. Next up is HAART, which stands for Highly Active Antiretroviral Therapy. The purpose of this is to reduce the person's viral load. Next is HIV infection, which is infection with the human immunodeficiency virus, which may or may not make the person feel or be sick. Next is infectious disease, which is a disease like the flu that is caused by infection. And I have a meeting to get to, so I'm going to let the narwhal end our show today, right after he lists the last few words.
Our next word is Kaposi's sarcoma, which is a type of cancer that is now frequently found in HIV patients. Next is opportunistic conditions, which are infections that normally occur only in someone who has a weakened immune system to AIDS or AIDs. Get it? And our last one is viral load, which is the amount of HIV per unit of blood. And there you have it, folks. This is Narwhal wishing you a gnarly day. Get it?